They have helped me tremendously. I've had jobs where the insurance costs more than the income I was making, and them has been a lifesaver for me and my husband. We definitely could not have gotten the care that we would have gotten. It would have cost us so much. So I just want to say that we appreciate it so very much. Blood work and x-rays and so many things.
You're really fulfilling a great need. You probably don't think it and you don't hear, but I promise you, you are. My wife says that the need and the niche that you fill, the honest truth is, if you weren't here, those needs would go unmet.
I've come here for my diabetes and just recently problems with an arthritic knee now, and they have just wonderful doctors, superb. And my experiences here, everyone's always so courteous. When I come, I go right in. I got here, like 20 minutes to 1, and it's 10 minutes to 2, and I'm finished. It's great.
I simply don't know what I would do without Volunteers in Medicine. To be honest with you, 10 years ago, I had no insurance. I had 3 kids. I was, single mom. And once I got on with the Volunteers program, they've helped me through breast cancer scares. They've helped me with hypothyroidism. I don't have to worry about when I need to see the doctor for an infection or just a routine checkup. They're wonderful. It's clean. It's friendly. It's just the most pleasant experience. So I recommend, and I'm so thankful and grateful for all those volunteers that have helped me be able to take care of myself medically when I couldn't have done so otherwise.
They also specialize into making you become healthy. They're going to be on top of you 24/7. My biggest problem was weight issues, and since I've been here, I have lost almost 30 pounds. So, I'm just trying to get my weight under control because I don't want to be, having diabetes, because that was my main concern also, which my weight been under control, so I'm not in jeopardy no more. Everything is clear. But one of my favorite doctors, which I shouldn't be saying, is Dr. Finley. She really have inspired me a whole lot. But without VIM, I don't know what I would do. But I really appreciate everyone. Everyone is amazing.
They have really helped me a lot when I'm out of whack with my insulin. They straighten it out, and I appreciate everybody that volunteers here.
I've been coming to Volunteers in Medicine for over 2 years now, and they've helped me with my high blood pressure treatment. They've gotten it under control. They've helped me with my asthma. They've helped me get free medication to help me with those issues. It's a great service. I don't know how I would ever make it without it, because I just can't afford all the treatments and the medications currently. But I love the people here. The volunteers are excellent. The doctors are excellent. And we value their service.
Durante todo este tiempo yo llevo aquí como unos 4.
During the 4 years that I've been here, they've always been very attentive. The doctors have always been able to take care of me. At the time that I had the problem with my heart, and they put in the pacemaker, they were able to help me have it checked every year or every time that it's been needed to be checked at no cost.
It was a blessing because I couldn't afford other doctor visits. I had no insurance, and I think that this was an excellent idea. Whoever came up with the idea of the uninsured. Working uninsured. I also discovered that I was always borderline diabetic, but once I came here, they diagnosed me full diabetic, which they have been providing my medications and all, and I'm doing fine. And again, thank God for Volunteer Meds.
I come here for my asthma. It's a great place. I can't afford my medications and stuff, or actually going to the doctor, and you guys have pretty much provided me with all of my medications, at least the most expensive ones.
The one for this place right here, I don't know where I'd be. It has helped me a whole lot.
at all. I have seen the best of doctors, and I appreciate it, and I thank them very much.
I don't have health insurance, and I cannot afford the medical treatment that I need. I have a lung disease, and I've not been able to see a lung doctor. So I really don't know how my lung disease is. My family care doctor, I usually see him, and he helps me fill out the paperwork to get my medicines from the makers, but I owe him money, and I don't have the money to go see him. So being able to come here is going to allow me to continue to get my medicine and check my lungs now and check some other things that we have going on to be sure that I'm either okay or if I need further treatment. And I'm going to be able to get glasses too now.
I think there would be two major things that would happen if VIM no longer existed. The first one is the health care for individuals who are the working poor. I don't know where they'd go. When you look at the numbers, the data has gone from almost up to 6,000 patients a year that they're caring for. That's a huge number that have really benefited from positive outcomes and high quality care that they receive at VIM. I think the second thing that would happen if VIM went away is many volunteers and many of our students would have lost the opportunity to experience working with those patients, to experience and understand that many of us are but a paycheck or two away from being in that same situation, being able to develop empathy, understand respect, understand the importance of realizing that this can happen to anyone. The impact that experience has on volunteers, and in my case, particularly our students, is probably more than the actual care that's given.
One day I got a call from Dr. Burt, and he sent a patient from Volunteers in Medicine, a fairly large mass in her breast. When she arrived, the radiographer asked her, "Did you not know this exists?" And she said, "Yes, I just had been pretending it didn't because I didn't have any insurance. And then I learned about Volunteers in Medicine." Of course, obviously her condition was very serious by the time that she arrived at Baptist. But here's the point I want to make. Wonder if she had learned about Volunteers in Medicine earlier. Could it have been that we could have caught that condition really early? Because as you know, this is a curable disease. So Volunteers in Medicine plays a vital role, and quite frankly continues to play that kind of role in our community, not only for the treatment of people that are sick or facing injury, but also potentially to really solve problems before they really become major problems in people's health.
In these difficult economic times, Volunteers in Medicine plays a crucial role in our community by providing primary care for those people who are working but are uninsured. That population has been growing in recent years. We at Mayo Clinic believe in giving back to the communities in which we live and work, and a number of our physicians participate in Volunteers in Medicine and thoroughly enjoy the process.